Phoenix and welcome to my YouTube channel. This is your girl Catherine Minor. Please call me Kate Mimi. So first of all, thank you very much for interacting with the previous video on self-breast examination. This could not have happened without your interest in wanting to know better about breast cancer awareness. Okay, so thank you very much. So guys, I want also to give a major shout out to Dave Kim 254 Studios. Please check out the link to his website, his social media handles in the description below. He has been amazing, isn't it? I know some of you have been commenting on the quality of these past few videos and it's good. So let's talk about pregnancy and breast cancer. What is the relationship? What do we need to know about it? So welcome and let's do this. So Team Phoenix, before I even start talking about pregnancy and breast cancer, it is very important that you connect with me on my social media. Please check out the handles in the description below. Please talk to me. I know I'm not very active in all of the sites, but I am learning, okay? I'm learning, and very soon, who knows, I might even start doing TikToks once you teach me how to do it. So guys, let's start with the facts. Fact number one is that breast cancer is increasingly being diagnosed in younger women. When I was in nursing school, I didn't have to wonder so much about breast cancer in younger women. I was being taught that breast cancer risk increases with age, and that is a fact. The older you are as a woman, the higher the risk of breast cancer. Okay, fact number one. Fact number two is that things have changed. We are delaying getting pregnant. We are focusing on our careers. Our environment has changed. Our diet has changed. Basically, things have changed. And breast cancer has also changed. It is being diagnosed in younger women. And when I say younger women, I'm talking about women below 40. Women in their childbearing age. So it is very important that we have that fact ready. Fact number three, people may not be very ready for the reality that breast cancer puts on dreams of motherhood. I had to go through this phase myself. I don't have a child, biological child at least, but I have very many children that I take off. Very many totos who are mine. Totos is babies in Swahili. Okay, watoto. Watoto means children, so very many totos. It's an endearing word. So I had to ask myself, what are my pregnancy dreams? What about motherhood? What about breastfeeding? This is a struggle I had to come to terms with when I was diagnosed with breast cancer, and I had to know my options. I had to know what this means for me and my dreams. So let's talk about it. Someone has to, one way or the other. Breast cancer can be diagnosed when somebody is pregnant. Let's start with that. When you're pregnant, due to the upsurge of the hormones, probably there was a breast cancer that would have been diagnosed anyway at some point in your life. But the fact that you're pregnant, it encourages it to be diagnosed. That can happen. When that happens, what are the options? Your oncologist will advise, most likely get the baby first, deliver safely, and then let us start treatment. If it is in the early trimester and the breast cancer is aggressive, you might be advised on termination or even an earlier delivery. Now, I don't want you to get hung up on this so much. I want you to know that every treatment is always individualized. There is no script fitting everybody at the same time. Treatment management of breast cancer varies across the board. It's not standard. Okay? So don't be very hung up on what is going on, where, to whom, and why it's not going on for yourself. Okay? Now, that's number one scenario. Scenario number two, it's mine. You don't have a child. You want to be a mom someday. Let's start with chemotherapy. Chemotherapy utilizes different medications, and these medications are meant to kill cancer cells or make the cancer shrink enough for it to be removed in surgery. Now, these medications are very poisonous to other parts of your body. Yes, they are going to eliminate or shrink or do whatever they are supposed to do to the cancer cells, but they will affect your reproductive organs as well. They're going to affect your ovaries, and in this case, they might make you enter an early menopause. So we need to discuss, how do we protect you? How do we make sure that you're able to get pregnant after treatment? And I want you to know that not every woman undergoes chemotherapy. I am an example of a woman that did not undergo chemotherapy. Remember, the breast cancer I had was diagnosed in stage 1. I know probably in developing nations, the standard treatment is surgery, radiotherapy, chemotherapy for everybody, no matter the characteristics of their individual primary tumor. That did not happen for me. My care was individualized. So for ladies who want to get pregnant and they have breast cancer, one of the options that you might be given is actually egg freezing, or what we call fertility preservation. Perhaps I need to use the word fertility preservation. When you talk about fertility preservation, it takes 3 different forms. You can freeze your eggs. By eggs, I mean your ovaries produce ova. The ova are what join with the semen to form an embryo. So you're given medications to stimulate the egg production. Every month, a woman releases at least 1 egg. If fertilization does not occur, you shed that in your monthly period. When it comes to fertility preservation, we want you to produce very many eggs at the same time. So you're given medications that are going to stimulate overproduction of your eggs. Caveat, some of these medications can actually cause a tumor flare-up. Tumor flare-up meaning that you have the cancer, but because of the fertility injections that you're giving yourself, in a view to make the eggs mature very fast, the cancer starts feeding on those hormones, and then it just goes crazy. With the new advances in treatment though, that risk is very reduced. So do not fear, the risk is low at the moment because of the advances in fertility medicine, if I would say that. So what happens? Once your eggs are produced and the doctors are happy that the eggs are now good size, you undergo scanning. I have to say, they will scan your womb. They have to look at your ovaries through a scanner, and they might do that every other day, or they might do it every week. Maximum egg production duration is usually 2 weeks. Okay, at least that is what I know happens in the United Kingdom. Some cases are different, and that is in terms of if it's a couple that are trying to get pregnant. But now I am just focusing on breast cancer related fertility preservation. Please do not misquote me. Okay, now we need to harvest those eggs. I know how that sounds. We need to harvest them, and by harvesting them, it means there's a procedure. You'll be taken to theater. Not that they're going to operate on you, they're just going to sedate you such that you don't feel it. And they're going to they're going to aspirate. They will use something like a needle. I know it's scaring, isn't it? And they will remove those mature eggs and store them and freeze them. When you freeze these eggs, it means that you can use them someday in future. Say you start treatment and you undergo some menopause or early menopause. That means you can try in vitro fertilization. Okay, so it's not every woman who will undergo chemotherapy or any other form of treatment who will have early menopause. Okay, but some can, and you do not know whether you will. So if motherhood is something you're thinking about someday in future, I want you to know that you have an option. And that option is freezing your eggs. Some people might say, oh, I am married and I want to have children with this man. So what are they gonna do? They are going to freeze an embryo. So that is the other second form of fertility preservation, that they can freeze embryos, so such that they join the ova and semen and they form an embryo, and then they store that. So when you're ready, you can go ahead and use that someday. Okay. The other one is about ovarian tissue preservation. Forget about this one because it is rarely used unless it's an emergency in terms of we need to start treatment right now. But you, on the other hand, as a woman, you're like, but I want to get pregnant someday. Please, I need an option. And then they can preserve your ovarian tissue. I know I am talking Greek right here, and I'm looking for ways to break down this information for you to understand it. When you preserve your fertility, I want you to think about it like an insurance policy. An insurance policy that you may never have to cash in on. Okay? So just because you have preserved your fertility, it does not mean that you definitely have to do in vitro fertilization. Some young girls in their 20s, in their early 30s, if they have, time and all other factors constant, they can undergo treatment and still be able to fall pregnant the natural way. Okay, so you preserving your fertility does not mean you'll definitely have to go the IVF route. Okay, you can easily get pregnant even after treatment without going for IVF. So I needed you to know about this because we cannot deny ourselves our desires. And I have to be very sincere with you. Motherhood is sacrosanct to a woman's dreams, whatever they are. So whether that motherhood means being a mom or not being a mom, I want you to know that motherhood does not just involve having children. I can also decide I have dreams about motherhood and they involve never being a mother. It's valid, okay? These are valid dreams, and we need people to know that they have options. Some people might go for surrogacy. That's another route. Some people might decide to adopt children. Whatever happens, just because you had a baby through IVF, adopted one, used a surrogate, it does not make you a less mom than the ones who had biological children. Okay? Some people may be advised by the medical team to have injections alongside the chemotherapy. These injections are particular ones that make the ovaries go to sleep, for lack of a better word. I know today is an intense topic, isn't it? So you're going through chemotherapy, yes. So remember, we said that chemo is going to destroy, including your other normal organs. It's just going to mess up with your system, okay? But these injections that they are usually given through your abdomen, just, or maybe through on your thigh or on your deltoid muscles. These injections make the ovaries go to sleep. Now think about this. The ovaries are active and the chemotherapy is flowing through the system. So they are going to be affected. But what if we put them to sleep? As you guys go to sleep, wait for me to get my treatment. So that is an option. Okay, guys? And it's usually one injection every 28 days, I think, until the duration of your chemotherapy is over. So that's an option. I want you to know what's happening, okay? Don't just be told, oh, you're having this injection and you don't know what it is for. For most cases, it is to preserve to make your ovaries go to sleep. Just to let them sleep long enough for you to have your treatment, such that after treatment, God willing, you're going to try for a baby if that's what you want, okay? The other thing is radiotherapy. Radiotherapy involves radiation rays, for lack of a better word, that are directed at that particular point of the breast to kill and burn any remaining cancer cells. That's what I underwent. I underwent radiotherapy. Now you may wonder, why am I bringing in the radiotherapy to a pregnancy and breast cancer topic? It is because radiotherapy interferes with the structure and composition of the breast, such that when you will want to get pregnant, or when you get pregnant, and I know you will, if that is your dream, then you might realize that one breast is going to be bigger, way bigger than the other one. Now let's go back to, let's backtrack. In pregnancy, what happens? Breasts become fuller, isn't it? They become fuller and they are ready to be suckled by the baby when the baby comes. But because you've undergone radiotherapy, you'll find that one breast, the one that did not have radiotherapy, becomes fuller, more fuller than the other one. So it might really mess up with your self-esteem if this is something that you were not told might happen. Okay? And then when it comes to breastfeeding, you will find some difficulty breastfeeding from the breast that underwent radiotherapy, because the cells and the lobules and the ducts were damaged during radiotherapy. So they are fewer in that breast than the other breast. Okay? So just watch out for that. Just know that it is a possibility. Okay? Yeah, the other thing is endocrine therapy. Endocrine therapy is, we give about 60 to 70% of all breast cancers diagnosed are estrogen or progesterone positive. What do I mean by this? I mean that of all the cancers that are, diagnosed, 6 or 7 out of 10 mean that they are feeding on your estrogen or your progesterone as a woman. So the very hormones that make you female are turning against you, in short. That was my case, by the way. The cancer was highly sensitive to estrogen and progesterone. So to prevent recurrence of breast cancer, okay, and to make sure that we give Catherine, or whoever you are, as much time as possible to continue living her life, we need to deny your body of estrogen and progesterone. I know how that sounds. So we need to put you on medications. One of them, remember guys, I talked about tamoxifen. I will attach that video here. I think it's a very good time for you to review that video. I had talked about side effects of tamoxifen. Now, tamoxifen is an example of an endocrine treatment. So some people will not have tamoxifen. Some people will have injections every month for the next 5 to 10 years. Some people will have other tablets that are going to basically do away with estrogen completely from other sources. Because estrogen is not just produced from the ovaries, it is also produced from our fat cells, okay? Our fat cells turn testosterone to estradiol, blah, blah, blah. We end up with estrogen. Don't worry about all the complicated medical jargon. It just means that it is not just the ovaries that we want to put to sleep so that they do not produce estrogen. We also want to put the fat cells to sleep. Now, this treatment is important, but at the end of the day, it can equally put you in an early menopause, I'm afraid. So, before that treatment is started, a good oncologist needs to discuss with you. Is fertility preservation something that you're interested in? Why I do these health talks, it's because I believe in information. I believe that if you know things, you will be able to ask the right questions. If you ask the right questions, then you're going to end up with the right answers. So know that this is there even before you start endocrine treatment, or what we call anti-hormone therapy. And I want you to discuss it with your doctors, okay? I'll tell you something. I feel more empowered as a nurse when my kidney disease patients ask me questions. Challenge me about new treatment plans and tell me, Nurse Catherine, I've heard about this treatment. Are you doing it at that hospital? And I have to think, oh, what is that? And I have to go and look it up if I do not know. Because when a patient is informed about their health, then you're very sure that they are going to be very proactive about prevention, about early detection. They're going to be proactive about screening. And when it comes to treatment compliance, you know that they are very good. So whatever medications you're going to give them, as long as you've explained what it is for, believe me, they're going to take it. And this is what we want as medical professions or professionals. Why do I keep saying professions? I have no idea, but I mean medical professionals. We need patients to be able to comply with the treatments that we are prescribing, but our problem really is we do not communicate the right way. So we fail to communicate before because we do not speak in ways that our patients can understand. So you knowing that there is something like fertility preservation, there is something like putting ovaries to sleep when you're going through chemotherapy, knowing that, oh, radiation can really mess up with my breast, and even when I am ready to get pregnant, then I will not be shocked to find that one breast is bigger than the other and the baby just wants to breastfeed from one breast and not the other. These are things that are very important when it comes to breast cancer and pregnancy. Finally, good news. And the good news is over 40%, according to the National Cancer Institute, of women who have undergone surgery, radiotherapy, chemotherapy, blah, 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 all those, they are capable of getting pregnant the natural way. Okay? So many women have gone ahead to get pregnant after their treatment, and they are doing extremely okay with their children. So it's not all doom and gloom, people. Okay? We have good news, and we live for the good news, don't we? So I don't know what else to tell you. Please ask me questions. It's very important that you ask me questions. And if I do not know, rest assured I'm gonna find out. Because I never thought that I would learn anything about breast cancer, or I would be forced to know more than I knew in nursing school. But here I am, ready to learn, ready to research a lot of things, and ready to share them with you. So thank you for coming to this rather intense video. Bear with me, a lot of triggers, red flags, but I am okay. So thank you very much. As always, interact with me. Major shout out to Dave Kim 254 Studios. And by the way, if you do not know about Dave Kim 254 Studios, you really are letting me down. Can you look at the quality of my videos nowadays, you guys? Surely you need to look at the quality, and then you need to look at the link below. You see Dave Kim 254 Studios, and then you hit his website, and then you ask him. If especially you are in the UK, you guys, you need this man. You need him and his wonderful team. So thank you so much, everybody, for watching, and until next time, it's